Hi, I'm Tim and this is Paws on Point. Enjoy the episode and don't forget to like, subscribe, share and leave a comment after.
Hi. You okay?
Dr. Russ Kennedy, thank you for joining us.
Hello, my friend. How are you?
I'm good, thank you. How's the world going for you?
Good. How are the pups? You just had a big litter.
Yeah, they're doing good. They are growing strong, fast,
Nice.
very fast.
Bringing service dogs into the world is really doing a wonderful service for everybody. So, congratulations on that for sure.
But equally, your service is what you're giving out to the world. I mean,
I was
some
hoping
people
you'd say
know,
that. I was hoping to be
sorry?
like a mutual self-admiration thing here. We'll start off with, yes, I'm doing my best, as I was telling you before, and we've talked before about, yeah, I'm just putting myself out there, and I certainly seem to be reaching a lot of places, and we just keep going because I really do think that the way that traditional psychiatry and psychology looks at anxiety and most mental dysregulation is flawed. It's very cognitive. It's very, if we teach you the right way to think, then everything will be fixed. And then everyone who does that and it doesn't work, they think that they're broken. And it's like, no, they just haven't given you the right tools.
Yeah, no, it's cool that you say that because the world does preach that if you think it, then you can change it. Do you know what I
Yeah.
mean? And was that something for you? Because obviously through being a doctor, through all the years and your own personal experience, was that train of thought there initially, and then you kind of reached the point where you're like, yeah, no, this is not
This
it.
is all working. Yeah. No, I think, yeah, because being trained as a medical doctor, you're kind of welcome, excuse me, into that sort of fraternity of, okay, well, this is how we think as medical doctors. And, clearly anxiety is a mind problem. So we have to change the thoughts of the mind. And I tried to do that for years. I think I had in my sort of my own personal health career, I think I saw like 10 psychiatrists and probably about 30 therapists over the course of, since I was a teenager until like probably mid 50s. And I still have my own counselor now that I see, 2 or 3 times a year for, 4 or 5 weeks at a time, just to kind of get a little reboot in there
Yeah.
too. I think just we lose perspective because we're always seeing the world in the same way. And sometimes that's good. And sometimes it just ingrains bad patterns that don't serve you in the long run. So it's really the creating the awareness about, how can I treat myself better? How can I see the resources that I have rather than focusing on, the troubles that I have?
Pause on Point is brought to you by Plausibility's Service Dog Society, a Canadian non-profit funding life-changing service dog partnerships for people who couldn't otherwise afford them. If today's episode has moved you, head to plausibilitiesservicedogs.ca and make a donation. Every single dollar goes directly to training and care. Nothing else. Yeah, which I guess if you're focusing, and that's not to say that this doesn't work for some people, but if focusing on the problem, I can see how that fuels the problem to a
Yeah.
subconscious level. So you deal with it consciously, but subconsciously it's absorbed and it's still there rattling around. You know what I mean?
And in the subconscious parts of our brain, the hippocampus, the insula, these are the parts that run our daily lives. We think that we're rational creatures, but we're not. We are run by an emotional program that got refined as children, and we're still running it. And what's worse, you can't see the label from inside the bottle. I think that we can't even see our own programming, and then we get into a relationship and it's like, oh, you see this completely differently. And then it's like I'm forced to either see it from their way or fight with my partner forever.
I mean, I know in your book that you have like literally exploded for you. It really
Yeah,
took off.
it didn't actually sell very well for the first year. It sold like, I think it was like 100 copies a month for the first year. And then something in August of 2021 happened and it sold like 3,800 copies in one. And none of us know what happened because I went on Mel Robbins, but that wasn't until October. So that wasn't even in the pipeline yet. And yeah, and then after that, it just started to take off and now it's sold well over 100,000 copies. So And it's in a second edition now too, which is really nice. They gave me a chance to go back and really refine it in 2024, which I did, and I'm really happy with it. The first edition is the red one, and it tells a lot more personal stories. And there's a lot of the first edition that I really like because it tells kind of my story. The second one is more of a how to manual of how to really understand your anxiety and see it as not a flaw, but as, part of the younger part of you that needs connection. And it will act out, that younger part of you will act out and create all this alarm in your system until you actually address the root cause of, why you created so much angst for yourself, why you focused on worry, why you thought worry was going to help you. And I think it's really important to understand that, yeah, most people think anxiety is a thinking problem that has a feeling component. I think it's a feeling problem that has a thinking component.
So it's almost in reverse to traditional thinking on that issue.
Yeah, and that's why traditional therapy, I keep interrupting you, but that's why traditional therapy doesn't work, is because they're operating on the principle that this is a thinking problem. And if it's not a thinking problem, if it's a sort of a subcortical below the level of the thinking brain, if that's where the problem lies, you can think all you want. But if the problem isn't, it's in the feeling part of the brain, you can do all the thinking you want, and it's not really going to change anything, which it doesn't. I mean, some people do get help from cognitive therapy. I'm not
Sure.
against cognitive therapy. I just think it's never going to heal you. It'll help you cope. It'll help you understand a little bit about what anxiety is, but it's not really going to help you heal.
So based on the feeling premise, that ties in with service dogs as a
Yeah.
whole because they create a feeling. So
Yeah.
if you so I'm I mean, I'm just chucking this out there. I'm nowhere near qualified to what you are, but
Oh, this
if
is great. I
based
like
on
where you're
that
going. Keep
premise,
going this way. Yeah. I
if
like
the
where you're going with
feeling
this.
is there, if you're anxious and you have the dog and the dog helps you with that anxiety, the brain automatically attributes that good feeling with a good thing to heal the bad that's going on in the head. Do you see what I mean?
Exactly.
So it
Yeah.
becomes the overriding part.
This is where dogs are wonderful, right? Because a lot of people with anxiety or depression or OCD had parents that weren't that great. So when you learn that you can't really trust people, and then you learn that you can trust animals, the love that you feel, because most people with emotional disturbances started off life as sensitive people in the first place. So if they are able to feel that sense of love and connect with that sense of love, that's what heals you, is that ability to love something and to transfer that love onto yourself. When I used to have Buddha, what I would often do with him is I would give him all these pets on his head and his body and stuff like that. And then I would have all this love for him. And then I would just shove it into my own chest because I would resist giving myself love. I would resist love from people because, my dad was paranoid schizophrenic and bipolar, so I couldn't really trust the love that I got from him. So when you can't trust love, but you so desperately want love, no wonder you're going to wind up like anxious or depressed or whatever. And I think what dogs do is they just give you that free ticket to love, and they love you back, and then you actually get to experience it on a level where the dog isn't going to leave you. Riley and Ellie aren't all of a sudden just going to go out the door because we feed them, we give them, we give them everything they need. They love us, so it's like we trust the love that we have for animals often more than we trust the love that we have for people. And that's not always the case, but it's almost certainly the case if you had parents that weren't really that great for you. So I think it's really important that we have something that we can really love, that we can really connect to. And dogs do that for us. Cats do, but dogs do that. Pets do that. Pets give us that place that we know that they love us, and we know that we love them, and that's one of the best parts. I do believe that traditional psychiatry and psychology really missed the boat in treating anxiety purely as a thinking problem. I really believe that what we call anxiety is a feeling problem first, a feeling problem in the body. And the anxiety is in the mind is just the brain's way of making sense of this, feeling of alarm that's stuck in your body that's probably been there since you were a child.
Was that something you learned early on in your career, or is that something that developed over time with your
No,
anxiety? huge thanks also to Helmcken Veterinary Clinic, a fantastic local team here in Victoria, BC, who genuinely care about the animals they treat and the people who love them. Knowledgeable, friendly, and always there when you need them. Find them at helmckenvets.ca.
I learned that from LSD. So I started practicing in 1991, and I kinda started burning out in 1992. So it was just like, not that early, but I did start getting disillusioned with medicine pretty early because I saw that a lot of the time we were basically just masking symptoms. Now, there's nothing wrong with masking symptoms. If pain relief is what clients need and patients need, then by all means. But in mental emotional issues, I really found that medical doctors tended to lean on medication more than connection with their patients. And it makes sense because we get 7 to 10 minutes with a patient. You can't really, go into someone's emotional structure and history and pain in 7 to 10 minutes. It's like a Monty Python sketch, someone's crying in front of you. It's like, "Oh, ding, next patient, please." It's like it doesn't
Yeah.
work. So you have to be able to be connected. And I think in medicine we get so used to doing that 7 to 10 minute thing that we don't really connect with our patients, and we kind of give the energy to our patients like, you've only got 7 minutes, so there's no point in getting into anything emotional. And if you do, chances are you're going to walk out with a prescription. So yeah, medicine really has its limitations as far as treating emotional things like anxiety, depression, OCD, that kind of thing. I think they really are treated in the are trained in this highly pharmaceutical model, which helps some people for sure, but it also doesn't give people a chance to really heal on their own either. We kind of take it over with medication, and it's been said that when you're a hammer, everything looks like a nail, and we as doctors are kind of trained as pharmaceutical hammers, so we just kind of look for what would be the best medication for this person, especially if we don't have half an hour to 45 minutes to get into their emotional world and their emotional pain and their history and that kind of thing too. So I think medication is highly overprescribed, but by the same token, I'm glad that we have it.
I hear that, and I think complementary medicine, if you like, works hand in hand with modern medicine. Not one
It
is better
tries
than the
to.
other.
It tries to.
Yeah,
It
no, that's
Now,
fair.
both sides don't really trust the other. The complimentary people think, "Oh, they're just pill pushers," and, the doctors think, "Oh, that's just witchcraft," half of the time. You know, there's a lot of stuff that's out there that's flaky on both sides. There's a lot of places where medical doctors miss the boat, but there's a lot of places where these alternative practitioners say, "Well, your doctor hasn't been able to help you, so we have the answer." And sometimes they do, but most of the times they don't. I think medicine has somewhat of a grasp on the cause of a lot of these illnesses.
Quick pause. If this podcast means something to you, following us is the single best thing you can do to keep it going. Every follow helps more people find us, and more people finding us means more change for the service dog community. So hit that follow button now, and let's keep going. Touching base on like when you mentioned earlier about traditionally medicine is about mind then feeling, but your approach is feeling then mind, so to
Yeah,
speak.
I think medicine really considers, like, anxiety is my jam. Anxiety is what I
Yeah.
had, what I struggled with, and so I believe that anxiety is much more a feeling state in the body that gets reflected by the mind. And medicine and psychiatry looks at anxiety as primarily a mind state that gets reflected in the body. And I think that mismatch in modern medicine and psychiatry really blocks their understanding and blocks the ability to get a really good treatment for it, because they're trying to treat a symptom, which is the worries, rather than treating the underlying cause, which is the feeling, the alarm feeling in the body that's probably been there since you were a child.
It's interesting because that, if anything, strengthens the link to service dogs and what they do, because it's the feeling part
Yeah,
that happens.
totally. Yeah, and the thing about a lot of people who have depression, anxiety, OCD, mental dysregulation, a lot of it was because they couldn't trust people. They couldn't trust their parents. They couldn't trust the people around them to keep them safe. And now you have this animal that loves you unconditionally, that tries its best to keep you safe. and does 100 times the job that your parent ever did. You learn how to trust basically through the dog. And if you can't trust love, you really can't heal. And one of the things that I see about my patients that have anxiety and the ones that have depression and OCD and eating disorders and personality disorders and all those kind of things is they desperately want connection, but they're also desperately afraid of it too because they don't trust it. So when you desperately want connection and you desperately are afraid of it, you're going to get anxious. You're going to have some problems in your mind because you've got two diametrically opposed forces acting within your own psyche. And one of the things about service dogs is that they always love you. They're always there. They're always consistent, which wasn't often the case when you were younger. Service dogs or dogs of any kind, they just provide so much love and an access to love that maybe you haven't felt in the past.
So by creating that alarm, if you like, I'm guessing that's where the mind does play a part in that, where if the original source of that alarm is no longer there, because of how strong it makes you feel, it will immediately seek another thing to anchor into. Do you see what I
Yeah.
mean? So then that
Yeah.
ends up carrying through your whole life if untreated,
Yeah.
dealt with.
And that's usually worry. When you feel this feeling of hollowness or this feeling of waiting for the other shoe to drop, the mind jumps right in there and goes, okay, here are the three things that you're most afraid of, and we're going to give those to you right now because your body appears afraid, and the mind is a meaning making make sense machine, so it will give you those things that you are most afraid of. It doesn't want to hurt you. It's not trying to hurt you. It's just trying to make sense of its environment. So if it's an environment of fear, your brain will say, "Okay, here here are all the things that you're afraid of," which isn't doing you any favors, and it creates more alarm in your system, which creates a further need for you to kind of try to seek certainty and worry in your mind, which it isn't there. Your mind can never really reassure you. You don't love from your mind. You love from this emotional state that you feel in your body. We feel love in our body. We don't feel it in our head. And if you ask somebody, "Who are you?" Point to yourself. No one points to their head. Everyone points to their heart. Everyone points to their chest. It's like, this is me. So it's really important to understand that I think that the paradigm that we use in medicine is highly intellectual and highly mind based. And I think it really misses a lot of the nuance of emotion. And really, life is in the nuance of emotion. It's not really in the thinking mind at all.
That's cool. I like that. I like that approach. And I mean, I'm just thinking, thinking to myself as you're saying that, like that moment when a client or a patient is mentally treated
Yep.
to
Cognitive therapy.
addressing
Yeah.
and dealing to feeling, that must be quite an overwhelming moment because it must be like a tidal wave because you're
It can
effectively
be.
opening a door.
It can be. And, if you're a really good therapist, you bring them into it slowly.
Mm.
You can't all of a sudden who hasn't really experienced love, you can't really shove them into love without them revolting because a lot of people grew up not trusting love. And this is true when, as medical doctors, when we're trained to treat paranoid schizophrenics, we are trained to go in there and be very flat, because
Mm.
they don't trust. If you went in there and said, "Hey, I understand you're having a hard time. I'm here to help you," that warmth and caring connection, they don't read it as that. They read that as something that they have to mistrust. And on a smaller level, I think that's true with all human beings, is that we have to move them into emotion slowly. We can't just, in someone who's been kind of emotionally frozen, you can't all of a sudden shove their face in emotion because they will revolt and go back to their old coping strategy, which is usually worry or depression or withdrawal of some kind. So you have to, it's the little analogy that I use is you're trying to catch an 8-pound trout on 4-pound test, right? So if they want to run, you got to let them run. And then you can
Yeah.
slowly reel them back in again. So it's really about doing this slowly in a controlled manner where they learn how to trust you.
This episode is supported by Trupanion, pet health insurance that's been protecting cats and dogs for over 25 years. Unlike many insurers, Trupanion offers unlimited coverage with no annual caps and direct payment to your vet so you never have to find thousands of dollars in an emergency. They even offer a discount specifically for service dog handlers. If your dog's health matters, and I know it does, head to trupanion.com to find out more.
And we don't have that
I
with dogs.
mean,
That's the thing. We don't have that. We immediately trust dogs. Like that's the thing.
yeah,
So I think dog. If you had a dog in psychotherapy, if a psychotherapist had a dog in their office, I think that would cut out 10 sessions, and $2,000 in payment if they just had that dog there that people could connect to immediately. And it's like, okay, well, this is the place that we have to go, rather than talk to them for 10 or 20 hours to get them to trust the therapist. Now that's a bit tongue in cheek, but there's an element of truth to that.
yeah. I'm just trying to visualize like it's a test pool of doctors in one, like, say, let's just use Victoria as an
Yep.
example. Pool of doctors, each and every one of them has a dog in their office.
Yep.
Would you see statistics suddenly shoot up where those doctors are meeting the time limit of 7 minutes, let's just say, because people are walking the door, see the dog, instantly calm, they're petting the dog, they're feeling good, and they're literally like, "Ah, to be honest, it's not that bad," and they're out. Next, and the
Yeah, and then
conveyor
there's the
belt
opposite
speeds
thing.
up.
Then there's the opposite thing, Tim, that they open up. That's and we don't
Yeah,
have,
yeah.
in the GP's office, we don't have time for that either. I remember when I was working in Vancouver at one of the urgent care clinics, and on my computer screen it would show me how long the next patient has been waiting to see me, and sometimes it would be like 2 hours and 12 minutes, 2 hours and 42 minutes. So I would learn, not consciously, but what I would stop doing is I would stop making a lot of eye contact with my patients. I would definitely stop touching my patients, unless I had to do like a chest exam or something like that. But just, affection, that kind of stuff. Because as soon as you touch somebody, and this is hairstylists will tell you this, they will tell you everything. Right. So what I learned unconsciously, and I didn't really realize it until later when I look back, it's like, oh, you stop really connecting to those people because that was the fastest way to get them in and get them out. And this is one of the reasons I think medical doctors are really getting a bad reputation now, is because we're on such a time schedule. I mean, I don't practice anymore, but I hear this from my colleagues. They're on such a time schedule that it's almost in their best interest temporally, like in a time-based situation, to be kind of detached, because that allows the patient, in 10 minutes to, okay, well, 10 minutes is fine. Like, I'll deal with it. But if you're warm and connected, you're in there for 20, 30 minutes. And financially, for a doctor, that's not going to make any sense. And unfortunately, as doctors are getting more and more squeezed by overhead, like everybody is in business, again, I don't think this is a conscious choice, but I think it's an unconscious choice to be less emotionally available to our patients. And when we do that, we cut down on our healing potential, because a lot of times the healing isn't in the medicine, it isn't in the prescription, it's in the connection that you have with your doctor. And we're losing that.
Yeah. Again, that fits hand in hand to those that are fortunate enough to be able to have a service dog. How you can see that incline in their overall health,
Yeah,
and and how. Before we go any further, if you're enjoying this conversation, do me a favor and hit follow wherever you're listening right now. Hit that follow button. It takes 2 seconds. Means you're never going to miss an episode, and it genuinely helps us grow. Right, back to it. How they become more outgoing when they weren't before,
totally.
because all of that anxiety that was maybe sat there that they weren't aware of, or they were aware of, or that was triggering other things, it all feeds into that.
Yeah. I think that the healthiest thing that you can have in your household is a person that you can trust unconditionally. And if you can't have a person that you can trust unconditionally, you have a dog that you can trust unconditionally. I think there's a tremendous amount of faith that we have in the world at that particular place, because we're love-based creatures. We're a connection-based creature. If we don't get it, we can operate, and some people operate and become quite successful overtly, but they find when they reach that success that there's no one there to share it with, and they haven't really learned that loving connection. It's really empty. It's really hollow, and I think more and more people are seeing, yeah, financial success is great, but unless there's a trusted source of love in your household, all the money in the world doesn't really mean that much.
I've personally seen, well, and professionally, I have seen a dog go into go into a situation where you wouldn't normally place a dog,
Okay.
but that dog took it upon themselves instinctively to go in there and immediately, and I mean immediately, defuse that situation, completely changed the whole dynamic, the whole way of thinking that was going on with that individual in the room. Literally, bang, just like
Yeah.
that. And it was a jaw dropping moment. I mean,
Yeah.
yes, that dog was there to help and
Right.
kind of be there, but to see how high that moment was, and the dog literally just walk in and completely change it within split seconds is phenomenal.
Well,
And
you used
on
to tell
that
me that,
note,
yeah, you used to tell
I
me that
have to
about Buddha.
say, like,
You
yeah,
used to tell me
I
that
know,
about my
but
dog Buddha, who's unfortunately
yeah,
passed now. But all the dogs would be kind of going each other or whatever, and then Buddha would, because Buddha was given his name. He's this big Labrador, Labradoodle. He was like 85 pounds, and he was just so mellow, right? So he would just walk
right.
into a room, and everybody would just kind of go, "Okay, Buddha's here."
But Buddha had a knack,
Yeah.
100% of projecting. Now, whether that was an intentional thing on his
Who
behalf
knows?
or whether
Who
it's
knows?
just something that happened,
Yeah.
but
Yeah.
he had that essence about him where he
Yeah.
would just walk in and it didn't, yeah, you would be like, you literally became, to phrase it any better, you literally became like the Fonz, and you literally wanted to go, "Hey," you know? No
Yeah. He
matter
was like
where
that.
you were in your head,
Yeah.
you'd
Yeah.
be like, "Hey."
Yeah. And yeah, he was the coolest dog for sure. Like he really, he really had this essence about him. And that's why,
Yeah.
that's why we named him Buddha, because he was just so, he just had this ability to kind of see the bigger picture as a dog, you know? And,
And I'd seen Buddha be in situations where things were happening, and he's just stood there like,
yeah. Yeah.
"Whatever."
Yeah.
Whereas a
Yeah.
very large proportion of dogs would be like, "No, no,
Yeah.
no." He
Yeah.
was literally like, "Give it a few more
Okay. Yeah.
seconds. This'll pan
Let's
out.
just wait. Yeah. Let's just wait
This'll
and
be
see.
good."
Yeah. Unless you had a ball, and now he was ball crazy. That was the thing that broke Buddha's nature, is like if he saw a ball, he was gone, But other than that, but again, coming back to your point, yeah, a dog can walk into a room and completely change the energy of that room. And some people can do that too, but it's very rare with people, but it's very common with dogs.
I think that has to do with dogs. They are unwavered even over all these thousands of generations in them being them. Do you
Mm,
see what I mean? Like their
yeah.
energy, how they function. Yes, we've styled that to a certain degree, but I think the core part to them is remained the same. So that's just carried on. But humans, we've developed, we've moved forward, we've pushed things aside, we move
Yeah.
faster. We And like you were saying about the doctors, whereas the doctor was someone would sit and listen and then diagnose accordingly, it's now got to this pressure kettle set state where it's like you have this particular time. It's all about
Yeah.
speed, move,
Yeah, for
next,
sure.
next, next, next.
Yeah. Yeah, and that's the unfortunate part about medicine these days, and I think that's one of the reasons why there is this backlash against doctors on social media, is because we've kind of non-emotioned our way out of, a benevolent picture in society. What I try and do with doctors is train them to see that a lot of the illnesses that they see in their patients are from non-connection. Those patients haven't had connection, maybe in their younger life, maybe in their current life. So, so much of this emotional disconnection that we're experiencing in our society results in physical and emotional dis-ease as we get older. And I don't think doctors recognize the the ultimate power of connection in healing. I think that we have gotten so used to giving medication that we don't really rely on that old bedside manner so much anymore. And it's just so important to make that emotional connection, because that's what heals us. I think it's really critical to kind of see that that's how we heal. We heal through emotional connection. especially with emotional disorders,
Mm.
with pneumonia as well. Yeah, you need antibiotics, but there's nothing like a nurse or someone who's around who's compassionate and connected while you're in a very vulnerable place. And I think we're kind of losing that in medicine.
The more you talk about the whole where the root of anxiety is, the more sense it makes. Do you see what I mean? It's like
Yeah.
you can I can see that for you. I mean, I know you said like I mean, I know your journey has been quite the journey getting to that,
Yeah,
but
it still took me about 4 or 5 years to develop a protocol or a pattern of treatment that really helped. But once I knew that my anxiety was rooted in my body rather than my mind, that really helped me create a platform from which I developed a real way of healing anxiety instead of just coping with it. So I think it was kinda like the eureka moment was LSD and just saying, "This is in your body, this isn't in your mind. Your mind is just reflecting what's going on in your body." And again, it took me 4 or 5 years to develop, a real, constructive way of incorporating this into a practice. But once I did, then I wrote the book, and then all of the other stuff sort of has followed from there, and certainly have a lot of physicians and therapists contacting me, and I'm in fact, I'm doing a practitioners program May through June just to show practitioners how my method works and how they can use my method to help their patients with anxiety. Because one of the things that why therapists burn out is that they see their patients once a week or maybe every 2 weeks for months and sometimes years, and they're not really getting a whole lot better. And
mm,
I think the reason is that yeah, you can have great cognitive therapy, but if the place in your brain that that houses that problem is below the level of cognition. And if you look at things like the amygdala and the insula, parts of our brain, none of those emotion generating structures understand language. They're all subcortical. They're all below the level of language. Their language is feeling. So it's like, how do you use feeling to heal? You need essentially you need to use feeling to heal a feeling. You can't use thinking to heal a feeling. It just doesn't work. It can make it feel a little bit better, but it won't heal it.
fueling it even more. I
Yeah.
love it.
Well, that's
It's
yeah.
great.
And the more I learn, Tim, the more I learn, the more it makes sense to me. And the more I help, doing things like this, going on podcasts, talking about it, the more it makes sense to me, writing about it, the more my method starts to make sense and the more things that I develop within that method to help other people get out of the hole that I was in for so long. So I had to develop that sense of, okay, how do I feel myself first? And then once I learned techniques and sometimes tricks to get beyond that resistance to love and connection, because that's basically why I think most people are anxious, is they want love and connection, but they're afraid of it at the same time. So once I learned ways of, okay, how can I break through and connect with myself, help me help you, right? It is that, and even now, like my mother passed away about 3 months ago, 4 months ago, I guess now, and my alarm in my system went up quite a bit, and then the worries came up, in parallel with it as they do, and I'm able to say now, it's like, nope, we're not doing that anymore. We're not doing that anymore. If your lifelong coping strategy has been going into your head with worry when you feel negative emotion in your body, it's very difficult to just sort of unhook that process. So you have to do it kind of gradually. That's what I was saying about just doing it gradually. Basically, it's feeling the sensation of anxiety in your body rather than staying in your head and just putting your hand over it and staying in that sensation without giving it an explanation. And then when you do that, you learn how to stay with that emotional discomfort and that coping strategy that you learn to escape from emotional discomfort by going off and ruminating in your head. When you tell yourself you're going to stay with the discomfort, you don't need that anymore. You don't need to bypass anymore because you're actually dealing with the root cause of it in your body.
All right. I think yeah, in danger of bleeding this into a 5 hour session. I think we
Sure,
can kind of call it
sure.
there. And yeah, I would love to have you back on again and we can explore
Absolutely.
further and
Yeah.
look at the different dynamics of it all.
Yeah. Well, thanks, Tim.
That's a wrap on today's episode of Paws on Point. A huge thank you to everyone involved in today's episode. These conversations mean everything to this community. If today's episode resonated with you, please share it with one person who needs to hear it. That's how we grow, and that's how we create change. And if you want to support the mission behind the podcast, head to pawsabilityservicedogs.ca. Every single dollar goes directly to funding a life-changing service dog partnership for someone who needs it most. Until next time, take care of yourselves and each other.